The motions that we're going to test next. First, we'll do dorsiflexion and inversion. So what muscle are we testing with that?
Hold on, I put those together.
Anterior tibialis. Okay, that anterior tib is going to perform dorsiflexion. I mean, it's our primary motion or primary mover as far as dorsiflexion by itself goes. It's a big, strong one. If that anterior tib isn't firing, that's when we get that foot drop. Okay. So anterior tib, and then after that, we're going to test foot eversion and plantar flexion. What muscles are we talking about with that motion?
Peronius, longis, and brevis.
Yeah, so peronius, but we got to remember that it's only two of the three, because the tertius does dorsiflexion, not plantar flexion, right? So we're getting the longis and the the longis and the brevis. Polaris, longis, and brevis. So we'll start with that anterior tib. First off, I'm going to move this up just a hair there. First off, if I leave her sock on and I start applying some resistance, because with this I actually want some rotation, look at what her sock is doing, or allowing it to do. It's moving around, right? And I don't like that, so we're going to take the sock off. And now you guys get to see her awesome tattoo. Anterior tib, dorsiflexion, inversion. So the motion looks like this and that. Okay? And it's that bringing it in, or adducting, of the forefoot where that kind of rotation starts to occur. And that's why we take that sock off. Because when we apply our resistance, we're going to go against that rotation as well as against dorsiflexion. So I'm going to essentially be trying to rotate her out into abduction and push her down into dorsiflexion. Okay, so it'll look, or excuse me, plantar flexion. Thank you. Okay, so I'm going to bring her up here, in there. Now I want you to hold that and don't let me move. Okay, I'm going to wrap around here, and I apply my pressure. And she's got a nice strong dorsiflexor, nice strong anterior tib. We started shaking a little bit there at the beginning, lost a little range, but then she held it. She started holding it really good. Okay, so I can easily give her a 5 out of 5. With everything other than the gastroc and soleus with plantar flexion, our grading is the same as normal. Okay, 5 out of 5. She's holding against my resistance for 5 seconds. 4, she starts to melt away, if you will. 3, as soon as I apply that resistance, she just falls down or can't hold it at all. Then we get into our grade 2. Okay, this is a combination motion, right? So if we're thinking dorsiflexion, what would we think was gravity minimal position?
Prone, knee up. Under back.
Okay, so but that would be, because if we're going to dorsiflexion, that would be gravity assisting.
Oh, okay.
Right?
Foot off the edge.
So really, if we're just looking at dorsiflexion, it's sideline. Bring her up here.
Internal rotation allows you to.
Or you can just leave her in sitting and pull her into internal rotation, right? But we're not just looking at dorsiflexion. We have that forefoot adduction as well, right? And if we get her in sideline, then that means for the forefoot adduction, now gravity is assisting. So pretty much all texts, and according to the people that first started doing manual muscle tests, the gurus and everything like that, when it comes to the foot motions, gravity plays such a minimal role, and because we're going through multiple planes, there isn't a gravity minimal position. So we go from a grade 3 being full range on her own, so she can bring her toes up and in just like that. I can give her a 3 just based on the fact that she can come up. However, if she tries to do that and all she gets is a little bit of dorsiflexion and doesn't go through full range, so just partial range, that's considered a 2 out of 5.
No pluses or minuses.
No pluses or minuses.
So if it's
Keeping it simple.
not full range of motion,
A 2. Yep. Okay.
That's normal, isn't it?
Hmm?
That's normal, isn't it? For 2? Not full.
Well,
can't do full range of motion?
Yeah, but 2 is full range of motion, gravity minimized, right? Normally.
But we don't have gravity minimum.
But yes, because the fact that it's multiplanar motion, we don't have to worry about, or we can't truly get them into a gravity
you
minimized
just keep
position.
them in sitting.
So we can do all of our tests from this position,
That's so great.
from 5 to 0.
So great.
Okay? Here's the thing that's the only issue I can see with not having a gravity minimal position. It says partial range against gravity is a grade 2. They don't define partial range.
Oh no.
Oh no. Right? So even if she just barely goes, "Eek," that's technically partial range. So if there's just that much movement, do I feel that's justification for giving her a 2? Or
Depends on the
Well,
day.
very subjective. When you take that gravity minimal position out, it becomes very subjective. That is the only drawback I can see with not having a gravity minimal position.
Well, I mean, what else would you give her, a 1? I thought a 1 would just be the contraction you feel.
Right. But if we see any kind of movement, that's technically partial range.
Right.
What would you have put it as?
I'd probably give her 1. I always tend to err on the side of caution, if you will, and go lower. Yeah. Insurance for one thing, as well as is it really a true representation of what they have. Yeah. Okay. So that's for the anterior tib. Dorsiflexion, inversion, or adduction of the forefoot, right? But then we've got our peroneals, peroneal longus and brevis. Plantar flexion and eversion or abduction of the forefoot. So out like that. Okay? For this one, I'm actually I'll tend to switch sides like this. So that way I'm pulling down and in up and in towards me. Yes?
Real quick, do we need to know the ranges that the book gives us for the?
For the
What's
norms?
the different, ranges, is that something we need to know?
No, not from the manual muscle testing book. No, because theirs are different than the Goni book. So, she's pointing her toe down and out, or pointing her foot down and then out like that. Try not to rotate one, okay? So there we go, just like that. But again, I've got this rotational component to it, multiplanar motion. So I'm going to put her in that position, hold it there, don't let me move yet, and then I'm going to wrap around, and I'm going to try and pull up into dorsiflexion while I rotate her into adduction. Okay? When you're testing the foot, try and 2 things. Number 1, try and avoid bringing your thumb on top of the foot, just because if I start to do that and I'm cranking down with my thumb, are you gonna like that very much? Patients aren't gonna like that very much, okay? So a lot of times, I'll just lay my thumb down on the side or keep it like this as I apply that resistance just to avoid it. You don't have to. If you keep your thumb on top, just be aware of it so you're not clamping down on the top of the foot, because it's gonna be very uncomfortable for the patient. Okay. The other thing, what are my other fingers doing? Well, they are wrapped all the way underneath. So if we bring our foot up like that, I've got them wrapped all the way underneath, and the pads of my finger are on the medial side, or on the opposite side of her foot. Okay, and by having it there, that's really going to help me get that rotational component. So I can push with all 4 of my fingers on that medial side, and then with the palm of my hand, I can push down on the lateral side and get that rotational component as I try and pull her up into dorsiflexion. No. Okay, because with these ones in particular, well, not enough to make a difference. We're not hitting the muscle belly, I'll put it that way.
Right.
Right? Okay. So, anterior tib, peronius longus, and brevis. Let's go ahead and test those.